So tomorrow Petra is having her operation, which we're a little bit nervous about because she has to have an anaesthetic. Because it's the night before her operation, we have to take her food away at 10 p.m. And this is because you're not allowed to eat for a certain amount of time before you have an anaesthetic. And so I'm just about to give her an extra treat. So we're going to give her some extra wet food tonight, just that she's got something in her tummy before I take her food away. So this is my son's activity centre, and the reason that I'm showing this to you is because Petra likes to chew on it. And so one of the first things that I noticed when I suspected that she was unwell was that if you have a look here, there's actually dried blood where she's been chewing it. Now, obviously, I do need to give this a good clean, but there's no point in me doing this before she's had her operation because she'll just go and chew on it again. And I need to figure out a way of getting dried blood out of this very strange material. Alright, so it's a bit of a madhouse in here this morning because we're trying to get a million things done at once. But as you can see, there are no food bowls here, so the cats have been meowing at us all morning. And I have now put the cat carrier up. They actually really enjoy playing with this cat carrier, so I like to get it out nice and early so that they can have a play with it, sit inside it, relax, get used to being in it again because it's not out all the time. And then when it comes to me actually taking them to the vet, they don't generally fare too bad. They once we get in the car, a bit of meowing does start, but yeah, generally not too bad. So this morning they're not allowed to have any food. Both of them are going to the vets. Zav is just gonna have a check to see what his teeth look like, but Petra is actually having her operation today, and that is why we're not allowed to feed them. Right, so I'm in the car, and as you can see, or as you can hear, they're not very happy about being in the car. Fortunately, the veterinary surgery is only 5 minutes drive away, so hopefully it won't be too bad, but there are quite a lot of speed bumps along the way, so this is going to be one noisy journey. Right, so we're here at the vet's. We have to wait outside in the car because of COVID restrictions, so I have sent them a text to say that we're here, and I've just got to sit in the car with these two cats whilst they meow at me. Hello, Zabby. So I've just got back from the vet. Petra has stayed at the vet's because she's having her operation today. And as you can hear, I've got Zavi in the car with me. So he's had a look at Zavi's mouth. They've taken a swab to check for the Calisi virus, but they're saying that his gums are quite inflamed. They're nowhere near as bad as Petra's, but they're suspecting that he probably has the gingival hyperplasia as well. And so the next step is that he is also going to need a dental cleaning under anaesthetic. So we need to get that booked in for him. The vet's going to have a proper chat with me later when I pick up Petra from her operation, so that's quite unfortunate. I was hoping that Xavier got away with it because his teeth did look a lot better than Petra's, but that's a bit unfortunate. Okay, so I'm here to pick up Petra. The vet did call me earlier, a couple of hours ago, and said that she was out of surgery now. Surgery did go well, but unfortunately when they were stripping back the gums on the incisors, which are the teeth at the front, the teeth were so badly damaged that they weren't even attached to the bone anymore. So essentially they'd just fallen out, and also the bone wasn't in great condition. It should heal, thankfully, with treatment, but essentially she has lost the teeth at the front. But if you think about it, this probably happened quite a while ago, and actually she's been eating fine without them, so hopefully that won't cause her too many problems. He did also talk to me about Zavi. He said that Zavi he wouldn't really know the full state of how his mouth is until he can get him basically in and under anaesthetic, but he thinks that Xavi has the same condition. He wants him under anaesthetic to do a complete cleaning. He has got bits of gum which have overgrown his teeth, but much thinner than in Petra's case, so when he does the cleaning he thinks that the gum will just come away quite easily rather than needing like an entire other procedure as such to do it. He did say that he thinks in some places that Xavi's mouth might actually be worse than Petra's in terms of the amount of pockets of bacteria which have built up. So he's gonna basically get Xavi in as soon as possible to do the dental cleaning for him too, and then do a full assessment and then let us know what the plan is. This one's a little bit slobbery because she still is recovering from the anaesthetic and it's making her dribble a lot. Look at that. Oh dear. I have to get her out and clean her up in a minute. So they've given us this pouch of bland food, and this is just for her to eat this evening and maybe tomorrow morning depending on how much she eats. It's just a bland diet so that she doesn't feel nauseous after she's had the anaesthetic, because that can often cause a bit of nausea and vomiting. We'll just give that to her now. And there we go, Pet. Apparently she didn't really eat much with them, but she's been drooling quite a lot and I think that's been making her not really want to eat. Then they've also given this Loxicam, which is a anti-inflammatory, and they want us to give that to her from tomorrow. Apparently she's had an injectable version today, but she's got to have that once a day for 7 days just to reduce the inflammation and the pain in her mouth. And then they've also given us this chlorhexidine mouth gel, which we're going to start for 14 days. It's twice a day. We just got to put it on both sides of her mouth. And Denticept is a antiseptic and antifungal mouth gel, and that's to prevent her getting any sort of infection. And then after that we'll move on to the MaxiGuard, which is the gel that we're going to use in place of brushing her teeth, because brushing her teeth would be far too painful. So this is the dental chart that they gave us. On both sides they extracted the incisors, and that is because when they looked at the gum they found that the teeth had actually already come away and just were embedded in the gum, so that's really, really sad. But like he said, the rest of the teeth are all in really good condition, so he's hoping that we can rescue them with a good intensive course of treatment. The only other thing to say is that he wants them on a dental diet, so we're going to need to buy some of that and then do a very slow changeover from the gastrointestinal sensitive stomach food that they're on at the moment, because they've had lots of problems in the past, which I'll do an entire video on that because it's a really important subject. And also on Saturday, so that's 3 days away, they want to see her just to have a look inside her mouth and check that there's no problems and she's not getting any infection. And then also they said that they would review her a week later, just again as another post-op check. And then talking with the vet earlier, he said that he wanted to probably have a look at her mouth in 12 weeks and then decide if he's going to do a 4-month interval or a 6-month interval for the next dental cleaning. So Petra's been home a couple of hours now and things are going pretty well. We've had to mop up the saliva a couple of times, but other than that she's eaten her food, she's had plenty to drink, she's purring, and the drooling seems to have calmed down, so I think she's on the mend. Petra! Hello. Be sure to give us a big thumbs up, and remember to subscribe so that you can watch the next in the series of vlogs. Xavi has his operation booked for 2 weeks time, so in 2 weeks we will be posting another dental vlog, so see you there.